COVID-19 had an impact on all of our lives. It was truly a time we wished we could forget. Nonetheless, the after effects of COVID-19 infection continue to haunt us. The majority of people infected with coronavirus feel better within a few days or weeks of their first symptoms and recover completely within 12 weeks. Symptoms may last longer for some people. This is known as long COVID syndrome or post-COVID-19 syndrome. Long COVID is a novel condition that is still being researched. Let's discuss. What are the main symptoms of this condition? Extreme tiredness or fatigue, muscle aches, shortness of breath, and loss of smell. Difficulties with memory and concentration or brain fog. Tightness or pain in the chest. Sleeping difficulties, insomnia, palpitations in the heart, and dizziness. What could be the possible cause of long COVID? People who had severe COVID-19 illness may have suffered organ damage affecting the heart, kidneys, skin, and brain. Inflammation and immune system issues are also possible. It's unclear how long these effects will last. The consequences could also result in the emergence of new conditions, such as diabetes or a heart or nervous system condition. Another factor could be previous exposure to severe COVID-19. People with severe COVID-19 symptoms frequently require treatment in a hospital intensive care unit. This can lead to extreme fatigue and post-traumatic stress disorder, a mental health condition brought on by a terrifying event. Two of the main adverse effects of long COVID are the following. The first one is breathing problems following COVID-19. A severe case of COVID-19 can cause scarring and other long-term problems in the lungs, but even mild infections can cause persistent shortness of breath, feeling winded after even light exercise. The recovery of the lungs after COVID-19 is possible, but it takes time. It can take months for a person's lung function to return to pre-COVID-19 levels, according to experts. Breathing exercises and respiratory therapy may be beneficial. Another major adverse effect is heart problems related to long COVID. COVID-19 infection can cause heart problems, including inflammation of the heart muscle in some people. According to one study, 60% of people who recovered from COVID-19 had signs of ongoing heart inflammation, which could lead to common symptoms such as shortness of breath, palpitations, and rapid heartbeat. This inflammation appeared even in those who had a mild case of COVID-19 and had no medical problems prior to becoming ill. Finally, let's talk about the treatment procedures for long COVID. While there is no specific treatment for long COVID, breathing exercises, meditation, physical and mental therapy and medications are all helpful in countering the persistence of long COVID. Hope the time you spent on this video was worthwhile. Thanks much.